Okay, in this segment, I'm going to show you how to glue on your breast forms. To do that, I'm going to show the products that you're going to need. To start off with, you're going to need the Hollister Medical Adhesive. Now, this is a genuine medical adhesive meant to glue on breast forms. So women who have lost their breast to cancer and one thing and another, other ostomy and medical devices that need to be glued to the human skin, this is the product that's used. So, and now this is another product, and it's a product that we sell called It Stays. And this is a totally water-soluble glue. Now this is great for if you have clothes that slide and move around. For instance, sometimes if I wear an evening gown and it wants to slide down off of me, I can put some of that glue in there and I can glue my clothes up, and it's absolutely phenomenal for keeping your stockings up. So if you have thigh highs that want to creep and go down your legs, you can use this water-soluble glue for that, and of course it just washes off with water, so your stockings aren't ruined, your clothes aren't ruined. And I've noticed that on other websites that they actually sell this product to hold on breast forms. Well, I'm just going to tell you that any water-soluble glue will not hold on breast forms, because as soon as you put a breast form on and glue it to your body, you're going to sweat and the water will instantly dissolve any water-soluble glue. So it's just not going to work. And there are other kinds of glues that people sell for breast forms that just don't work. They're just plain taking your money. Also, I've seen different kinds of tape to hold the breast forms on. Well, tape don't work either. Tape will not work to hold a breast form on. So the purpose of the tape is to keep your breast forms in place if you just have a bra on and where your breast forms could pop out, move around. It just kind of makes a sticky surface so that they would stay there. But as soon as you take your bra off, particularly any moisture, body oils, obviously perspiration is going to make them just fall right off. So tape, water-soluble glues, some other adhesives, just no good for holding on your breast forms. You know, some breast forms weigh 2.5 to 3.5 pounds. I mean, that's a lot of weight trying to come off of your chest. So it does take a good amount of glue to hold them on, and particularly if you want to swim in them or shower in them or one thing or another, you got to have a good adhesive. So that's why you need the Hollister adhesive. Now, because it's not water soluble, it takes a darn good remover to get the adhesive off, because once you get it on the back of your breast forms and once you get it on you, you got to get it off. So we have our medical adhesive remover. Now, this is absolutely by far the best remover on the planet. And what's so good about it is that it's a denatured petroleum-based product, which means that you can put it on your skin. Now, there are a few other removers for the Hollister, but they're a direct remover. In other words, if you put that remover on the back of the breast form with the Hollister on there, it will come off, but it's very aggressive, and a lot of people have an allergic reaction to it and break out from the remover. Our remover is basically a two-step process. The remover, when you put it onto the back of the breast form or yourself, what it does is it changes the chemical properties of the Hollister from an adhesive to a water-soluble product. So that what you're going to do is that you'll put the remover onto the breast form or onto a paper towel to yourself, and I'll show you how to do this. Then you move that around either in the breast form yourself. The Hollister then is washable by soap and water. You could wash for the rest of your life on a breast form with soap and water, you'll never get the Hollister off of it. It is just not broken down or diluted by soap and water. So you have to have a interacting chemical compound of a special remover to make the Hollister come off of anything. So that's what our removers do. And we sell two of them. We sell a 12-ounce bottle and we sell a 32-ounce bottle. And also we have this available on our website in combo packs where they come together. Also we sell a 4-pack of this at a discounted price. So you'll want to check the website for that. Welcome back. And in this segment, I'm going to show you how to glue your breast forms on. And to help me with this demonstration is my lovely assistant, Tammy. So, for Tammy, because she measured 42 inches, Tammy has selected for herself a pair of 42 DY breast forms. So that's what we're going to attach to Tammy today. So, now what we're going to do is we're going to use the Hollister medical adhesive. And to start this off, we're going to take the top off, we're going to shake it up, and we're going to apply the Hollister. First is hold the can about 12 inches away, and I'm going to give a little squirt to get my aim. And then I'm going to squirt this in a circular motion on here, leaving my my streams about a ½ inch apart. Just like that. Now, I'm going to come over here. Excuse me, Tammy, I got to lower down your top. So now I'm going to take this and I'm going to put it to right where I want it to be. I'm going to touch it to her body, and then I'm going to move it around just slightly in a circular motion. So I want to get the glue spread on all over the back of the breast form and on Tammy. Then I'm going to take it and I'm going to squish it because I want to roll the glue all the way out to the edges. And then I'm going to set this down and I'm going to let this wait for just a minute while I do the other one. So again, I'm going to take the glue, get my aim, I'm going to put this on like this. Now, for the sake of demonstration, I'm going to put this one on in a little different position. I'm going to turn this one sideways to show you the difference between the way that you can put them on there. So again, I'm going to get the glue all over her chest and on the back of the breast form. Now, I have trimmed my nails prior to doing this, so my nails will not puncture the breast form. You have to be very, very careful doing this where you're squinching the breast form and holding it with sharp nails because they will damage and ruin the breast form. So you have to be careful about sharp objects, underwire bras, fingernails, no teeth, Tammy.
No teeth.
So now, the minute I touch this, it's there. It's not coming off. So you're not going to put it here, then move it and put it over there and move it here, because once you touch it, it's on. So I'm going to line this up exactly where I want it, and I want to put this in the 11 o'clock position, not like this, not like this. 11 o'clock for the top. I'm going to step the bottom in first, and I'm going to roll it on so I don't have an air pocket behind. And if you notice, it glued very, very nicely, very well. And this is the distance that I usually put between the two. Now for this next one, I'm going to change the location by putting it sideways. And there's a reason for that, which I'm going to show you when I'm done. So I'm going to line up my bottom, I'm going to stab this in, and then I'm going to roll it on like this. Now this is for demonstration purposes only. If Tammy had a full top on, whoops, this is actually a Jan mini skirt that we're using. Now, if this was a bandlon top, we would have a problem here because this would show. So for that, you would turn the breast form sideways so that this doesn't become a ramp to slide your clothes off. Also, if you remember, we do sell the water-soluble glue, which is real good if you want to glue your clothes to the breast form in case it did want to slide down. But if you're going to wear, you know, a really low-cut dress, you might think about rotating your breast form this way. Otherwise, they go on at 11 o'clock and 1 o'clock, just like that. That's how they are. Now these will stay on for days, about 2 days. But if you leave them on for a real long time, after a while you perspire behind, you could get an odor, and they start to come a little bit loose. But that's how you glue them on, just right like that. How do they feel on you, Tammy?
Quite large. Large and lovely. Actually, I'd like to have a mirror to see what they look like.
Oh, wow.
How do they look like?
You can watch the video.
They look fine?
Now that's a D. That's a 42D on a 42 chest. Now I'm going to show you how to remove these breast forms. Okay, down comes your top again. Now, removing them is a lot of times what damages them. So you have to be very careful when taking them off. Because right now, when they're glued on like this, there's a lot of weight that's pulling from the back of the seam. Okay? So if you're rough at taking it off, you just get in there and you start pulling on this here, you can break the seam on the side. And all it takes is a little tiny rip in the seam on the side, and you'll start to have air bubbles inside the breast form. But we don't want air bubbles inside the breast form. And that's how they get there, is a tear in the seam, usually from rough handling and rough taking them off. So you want to get behind very carefully, and you want to work that breast form off, causing as least amount of trauma to the breast form as possible. Don't just take them and go pulling on them really quick, because you can break them. So this is a very gentle procedure in taking them off. So this one here, same thing. You want to be very careful in taking this off. Now, if you're going to be concerned about having the edges glued very tight to your body, after you put the breast form on, toss a bra on real quick for about 10 minutes. And the bra will take the breast form. Pull your top up for me. Put the camera on me. So, if you wear a bra with this on there, it will tightly hold the edges up against your skin while the glue is setting up a little more. So, that will help get the seam really tight to you. If you just glue it and let it sit there, it may pull away a little bit, as it did with Tammy. For the sake of the demonstration, we were in a hurry to get going. But and they were fine. They would be glued and stay on for a long time. But if you wanted to get really tight seams here, as soon as you put them on, put a bra on, which will hold them for a while so that your seam gets a chance to glue tight. And that'll give you a little better transition right there. So now that we have glue on the back of this breast form and on Tammy, we're going to want to remove that glue. So this is the next procedure for that.